Good afternoon. I thought we would get started. Oh, I hear the air conditioner. So, welcome everybody. It's a very happy occasion today, and I appreciate you all coming out to hear about our new technology at the hospital. So, actually, as a female, as a healthcare professional and nurse, and also as a consumer of mammography services, I'm very, very excited that we have this new technology, the digital stereotactic biopsy equipment and the prone table at Northern Dutchess Hospital. Anytime that we can bring new technology to our hospitals in HealthQuest, it's an exciting time. And certainly, the more patients we can treat close to home, the better it is for our patients. So I'm really thrilled today to be recognizing the Dyson Foundation, as well as the Northern Dutchess Auxiliary, for really funding 100% of this new technology at Northern Dutchess Hospital. So before we get into really the details, a little explanation about the technology, which will be from Paul King, our Director of Diagnostics, I wanted to welcome Rob Dyson here from the Dyson Foundation. I'm going to ask him to come up in a moment. And with him today is Diana Gurieva. She's the Executive Director of the Dyson Foundation. Molly Dyson, a board member. Note the name. And Jennifer Drake, who works with the Dyson Foundation on grants and programming. So with no further ado, Rob, would you like to come up and say a few things?
Thank you all for coming. This is sorry. There's one in every crowd, isn't there? Hold on a minute. Sorry. Modern communications, huh? What would we do without them? Probably a lot better. Anyway, I want to thank Denise for a lot of things that she has done and is going to continue to do, not only for Northern Dutchess, but for the HealthQuest system. I want to thank my daughter Molly for coming to attend this celebration, really. I want to thank Diana for all the consistent work that she does for the foundation day in and day out, and ably assisted by one of our top people, Jen Drake, who, in addition to, did you have your baby here? In addition to having a baby here a year and 3 months, she also lives in Rhinebeck. So you're talking to real users here. Molly lives in Rhinebeck as well. And so we have a deep tie to Northern Dutchess Hospital over and above the commitment that we have to creating competent, wide-ranging local healthcare services here at Northern Dutchess Hospital. This is a project that's very important to all of us, primarily because it serves the most important component of our society, and that is women, who it's currently fashionable among certain members of a certain political party to denigrate women and their role and denigrate women in healthcare services. We believe that we should be reinforcing the role of healthcare and the importance of healthcare for women, and this is our way of actually, in point of fact, in a real term, reinforcing that belief. I look forward to, if you haven't seen the facility, you should. It's really neat. And I'm honored to be here, and I'm honored that the foundation was able to make it possible, along with the auxiliary, which is a vital part and an important part of the delivery of health care here at Northern Dutchess. Thank you.
Thank you, Rob. I would also like to acknowledge that Rob is the new chairman of the HealthQuest board as well, so he is wearing many hats these days. I'd also like to ask the auxiliary to please stand up and be recognized. I know there's some representatives here from the auxiliary for all your hard work. Some of them are working right now. As you can see, these ladies and gentlemen are amazing in their dedication to the hospital and in raising money for very, very needed programs at the hospital. So thank you very much. So with let's call up Paul. Paul King is our Director of Diagnostics. And he's going to review the technology with you very briefly. And then afterwards, there'll be some tours and some refreshments. So thank you.
A little taller. Thank you, Denise. I just thought it would be appropriate if we could take a few minutes to just talk about the growth that we've had in the center over the last 10 years. It really started in 2001. We started with a $15,000 donation from the Northern Dutchess Hospital Mothers Club, a community group supporting women's and children's services at Northern Dutchess Hospital. It wasn't long after that, a few years, that we added the first Stereotactic unit. In 2006 was the dedication for the Dyson Center for Women's Imaging. This was a comprehensive diagnostic center offering bone density services, ultrasound services, mammography, and biopsy procedures. In 2008, we brought along the first digital mammography to Northern Dutchess Hospital, technology that helps offer earlier detection for breast abnormalities. In 2011, the Dyson Center saw over 6,000 visits. 3,000 of these were for mammography services alone. Of these visits, 3% of patients unfortunately needed to go on for further invasive biopsy procedures. 20% of the patients who needed stereotactic breast biopsy could not be completed at our center because of limitations with the equipment. I'm happy to say that replacing this equipment will allow us to better serve the patients that are visiting and help meet our mission. Purchasing this new equipment was obviously the next step in completing our center. I'd like to add that the American College of Radiology has accredited both the mammography and ultrasound breast imaging services that we offer in the center. This new equipment now positions us to apply for Northern Dutchess Hospital to become a center of breast excellence by the American College of Radiology, and we hope to have this completed by the end of this year. I'd like to extend my personal thanks to the members here from the foundation of the Dyson Foundation, the Women's Auxiliary of Northern Dutchess. And importantly, I'd like to thank our staff. Some are here today in the audience. Without you, we would not be able to offer these services, so thank you very much.
As promised, we said that we would be brief today and just really wanted to call everyone together. It's important that we recognize this milestone in our development and that we celebrate every moment that we can bring new technology to the hospital that can better serve our patients. So with that said, Paul is going to help us lead some of the tours with some of his staff. You can kind of gather over there and we'll take you over in smaller groups, and the rest, while you're waiting, you can enjoy the refreshments. And once again, we thank everybody for your role in making this happen here at Northern Dutchess Hospital. Thank you.
Are you coming in? Yeah, we're trying to find Rob Dyson. We're not sure
He's behind us.
if he knows where to go, but I'll come.
I can wait for him.
Okay, go ahead.
Bob, you see this little indentation here?
Yes, I do.
That's what grabs the tissue when you sample it.
So if you use this, then you don't need an ultrasound?
No. Actually, most calcifications are seen better with mammography, not ultrasound. So they prefer to use this. Sometimes they will use an ultrasound, but not all the time. So we take our samples, which literally takes maybe a minute. It goes right around in a circle like clock. It takes little tissue samples. And then at the end that looks like a calcification to me, but we put a little clip in. So that way, anytime you go back for your next mammo, if they see that clip, they know that's the area that's been biopsied. So,
Oh, okay.
pretty cool, pretty high tech, huh?
Yeah, it is. I'm going to tell them. Yeah.
Okay, honey.
Okay, thanks very much.
You're welcome.
And
You
then
have a
from
nice
there,
afternoon.
they come over here?
You want me to tell you how the study goes?
Yeah.
He's pushy. No, first we bring the patient in. The patient lies flat on their belly, okay? We position the breast through this opening, and then underneath here is our paddle. So we get the patient up, bring the table up so the doctor can work underneath. This is like the top of the line table. I think it's the nicest one. I don't think there's any other ones
So this
around.
is what
This
they've
is
just
called the
bought.
Platinum. Yeah.
This is the brand new.
Yeah.
This-
And to my knowledge, it's the top of the line. It's the nicest one that's around. So we bring the breast through here, and then we compress with the paddle to the area, that we're concerned with. The needle actually attaches onto here, so it goes right through this hole. We have a biopsy vacuum device that we hook up to it as well. What that does is it creates like a suction, so when the samples are being taken, the suction pulls the tissue right into a canister and collects it for us. So we put the breast in. We want to make sure that we have the area of concern. So that's when we go over there and we take a picture. Once we get the picture and we see that that's the area, then we do what we call a pair. So we turn our camera like this and do one shot at one angle, and then we go to the other side. Then the doctor goes over to the monitor, which I have a fake study up there, and targets the lesions. So I'll actually target one. So you just bring the box over it, you target the tip of the needle.
Is that the needle? What is that?
It is the needle.
The white thing is a needle?
Yeah. And then you just hit transmit. And then the coordinates transmit to the machine and tells the machine right where we're going to target. So.
Start at the beginning. I'm sorry. Your turn.
I've done like 4 of them.
And Jen, since
Before you talk about this, I think what's important is to understand that our old machine was called upright technology. So all of the work that Jackie's going to describe that happens under the table, out of sight, used to happen right in front of the patient. So imagine having that biopsy procedure and you're watching all of this activity sitting in a chair. Because of that was some of the limitations that we had, that a high percentage of our patients couldn't be completed here. So.
It was hard as well in the upright. You couldn't get back close to the chest wall. Where now with the prone, you're lying on your belly and gravity is pulling you, so you can get much further back. So.
And our first patient was 90 years old, I believe?
Yeah.
91.
so just real high level.